Hi, everyone. Welcome to our Spotlight series. Today, I'm thrilled to introduce Dr. Sonal Dalal of Chatham Chiropractic in Chatham, New Jersey. Dr. Dalal's a doctor of chiropractic medicine, but she's also has a ton of experience in functional medicine, and she's a certified functional medicine practitioner, and she brings the whole body systems-based approach to health and wellness. Her practice combines expertise in non-invasive chiropractic care with functional medicine to help patients address the root cause of their health issues. And she's very customized, very concierge style practice, very personable. She meets each patient with a complete conversation about what's going on with them. I've been a patient of hers, and it's been very, very enlightening to learn from her and also see what issues are going on with me that I wasn't able to find out with my regular primary care doctor. So it's definitely worth seeing a functional medicine doctor for those reasons. So we're going to be talking to her about her journey, how she got into functional medicine, her unique approach, her holistic approach, and her approach to health and wellness overall. And just one fun fact about Dr. Sonal, she has a really sweet and beautiful therapy dog named Fiona, who is also part of her patient experience. So thank you so much for joining us today. How are you?
Great, and thank you so much for having me. Really appreciate it.
Awesome. So I'm excited for the interview to learn more. So just tell us a little bit about how you became interested in functional medicine and what kind of got you into doing functional medicine. And a little bit, I know you still do chiropractic, but functional medicine is a big part of your practice that you're growing. How did you get into that?
Well, really, as a chiropractor, I've always kind of embraced a holistic approach to my patient care. So from day one, really, we were always suggesting nutritional advice and lifestyle change advice from the get-go. And back in the day, in the 90s, we were even doing 24-hour urine testing, hair analysis, and mineral testing just to identify mineral imbalances, to identify heavy metal issues. And we were doing saliva testing for cortisol levels. So that was back before people knew anything about functional medicine. Also, when the 4 a.m. movement started, which was the first anti-aging movement back in the 90s, we attended every single one of their seminars to just be in the forefront of that education. So it's kind of been a very natural segue. And then when COVID hit, I had some extra time and I decided that I would get a certification, a formalized certification, so I can do this on a formal level.
Very cool. And I know that when I came to see you, and the timing was really interesting because I came to see you and then I had a physical like about a month later. And the results that you told me were like so similar to my primary care doctor results, but they were just more holistic. And you were able to give me a list of supplements and like different foods I should eat that were going to help me with where my deficiencies were. So I thought that was really, really cool. And some of those foods, like I really make sure I prioritize like blueberries. I remember like the cruciferous vegetables, like I still do
Right.
all of that, and it really helped me a lot.
That's
Um,
great.
so in terms of just like your mission and your why behind like Chatham Chiropractic Center from the very beginning, like tell me about why you decided to open Chatham Chiropractic. Just like what's your backstory?
Oh, my backstory. Well, so actually, I bought Chatham Chiropractic Center from the woman that I worked for, and Chatham Chiropractic Center has been in existence since 1975.
Oh
And
wow.
I've been working in it for a very long time, let's just say. And then I bought the practice over, and so I've continued it. But really, our mission statement is that, we really have our core belief is that we believe the body has an innate ability to heal itself. And if you provide the body with the right support, then you can completely change the trajectory of your life and your health and happiness. So it's really about giving the right support. So we give it with chiropractic care, we give it with functional medicine, and it's just a delight to see lives change.
Yeah, the combination I think is like key. So, I know that functional medicine is probably one thing that really does set Chatham Chiropractic apart from other chiropractic physicians or practices. What else would you say makes you different?
So, I think one of the things that people may find different about us and maybe don't know about us is that we are, first of all, like a concierge type of service. Okay. It's very one-on-one. Even with chiropractic care, we spend a lot of time with our patients in the room. With functional medicine, no single person is the same as another. We sit down with you, we have formal conversations, we provide support from the beginning to the end. You know, the other thing that someone may not know about our practice is that it encompasses quite a holistic wellness center. We have not only chiropractic, functional medicine, but also massage therapy, craniosacral work, neuromuscular therapy, and we've also added soft wave to our repertoire. So there's a lot of ways we can help people.
Can you tell us a little bit, just because you brought it up, about soft wave and who would be a good candidate to receive soft wave treatment?
So that's a good question. So soft wave is basically kind of like PRP without the invasive drawing your blood, spinning the platelets, and getting the stem cells into the area that is injured. This is sending a shock wave, which is a little bit painful, but they dial it back to what you can handle. And that kind of shocks the system a little bit to trigger your physiology to bring stem cells to the area of injury. And who is a good candidate for that? Well, anyone with like chronic joint issues, knee, shoulder, if you have a rotator cuff syndrome or rotator cuff tear, or you are staving off like getting a knee replacement or a hip replacement even. I've seen it do wonders on people like in 6, 7 visits. The good news is that it's covered by Medicare, so that's kind of helpful.
That's really good.
Yeah.
How long are the sessions?
The sessions are really 15, 20 minutes long,
Okay.
and they're quick and easy. You're in and out.
And
And
then do you
generally,
usually have to do an evaluation prior to that, or they just book a soft wave appointment? Like, how does a person get their first treatment?
so they book an appointment through us, but we do not ourselves are not doing the soft wave. We have the owners of the soft wave machine and company come in and they do the evaluation. You sit down with them, they will tell you if you are a good fit for their,
Oh, okay, cool.
for
That's
that.
awesome.
Yeah.
Yeah, I know.
So
I've heard
they're in
great
my
things about it.
office.
I
They're in
wish
my office once a week.
I wish I knew about it when I was dealing with my frozen shoulder, because I know somebody who did it for frozen shoulder and it helped her a lot. But
It's really helpful. I can tell you
yeah,
from firsthand experience.
yeah, yeah. No, that's
So,
really good. So let's go back to the functional medicine and
sure.
tell me about, like, I know patients ask us all the time about, functional medicine doctors, and there's different people who go into functional medicine. So like,
Mhm.
whether you're a chiropractic physician, who I know they go into functional medicine a lot, or doctors, they sometimes specialize in functional medicine. Is there a difference going to one practitioner versus another?
Well, that's a great question, really. To tell you the truth, there are a lot of different types of functional medicine practitioners. And yes, anyone in the holistic field can go into it. In fact, even there's some nutritionists who are going into it, a lot of nurses, MDs, chiropractors, many people. There's all different specialties, I'm going to say. People will specialize in different things. Like, for example, some people will only do Lyme, some people will only do autoimmune, some people, or I should say, they're really good at it. What you want to find is what someone is really adept at,
Okay.
you know? So, because there's so much out there, you know what I mean?
Hmm.
So, let's say somebody's really specific with Lyme's or autoimmune, you want to go there,
Okay.
you know?
So what do you have a specific area that you tend to work with more?
I do, in fact. I love to work with people with GI issues. I'm adept at reading those tests. I'm adept at identifying patterns and giving a protocol based on that. Also, people with anxiety, sleep issues, and some hormonal stuff. So I'm adept at all of those things. And I mean, I pretty much know my repertoire. If I feel like you could use something, someone with a little bit more specific background in something, I will send you that way,
Okay.
because I'm a strong believer and not everybody can do everything, you know.
Yeah, so someone who has like maybe IBS or Crohn's, or even like, perimenopausal, menopausal women who are struggling with symptoms of sleep or um,
Anxiety,
yeah,
right?
all of that
Yes,
stuff that would.
pain with menstrual cycle. Yes, I mean, I see all kinds of GI issues, bloating, gas, constipation, um, all kinds of things, IBS. And so, absolutely, I can help people who are
So what does
hurting.
the journey look like from someone who calls you? Let's say someone calls you and says, I'm dealing with IBS and I wanted to explore functional medicine. What happens next?
So if someone calls, and we talk to them on the phone and we both, I explain to them what I can do for them, they explain to me their goals, and if we feel you're a good fit, then the next step would be to fill out a comprehensive health questionnaire. And then come into my office for a one-on-one interview. And also, I could do it on telemedicine if they didn't want to come in. That's fine too. I've done people in Texas and Utah and
Mhm.
other places and even different countries, actually.
Awesome.
Um, so I'm open to all that. Then we sit down, we review all the testing that you've done in the past year, if you want to bring it in, and we review your goals and your health issues. Based on that, then I do three different kinds of tests in my office. We do a saliva and urine test to find out about your hormones and cortisol levels. We do blood work and urine test to find out about what's going on in your cellular health in different systems. And then we do stool testing to find out what's going on in your microbiome. So we decide what tests you should do. We then send the test kit to your house. You can generally do most of them at home, send it
Mhm.
off to the lab, and then the lab will send me results. And I will sit down, review the results, make a 6-month protocol for you, which will include review of the test findings, understanding them, lifestyle changes, nutritional advice, and a supplement program. In that 6-month protocol, we also include a uh, consultation every month just to help keep you on progress.
That's good.
So,
I think that's key to have that because people, I'm sure, have questions that come up or different things I'm sure come
sure.
up.
And I want you to succeed. So
Yeah.
my goal here is to support you in any way you need so you can succeed.
So at the end of that 6-month period, would the goal be obviously you would retest? Would you retest at that point and then expect an
I, I
to be
I give
improving?
people the choice. If they would like to retest, certainly we would love to retest because, health is like peeling layers of an onion. So there's always going to be something you can work on.
Mhm.
Um, However, if someone is very satisfied with their results, which, many people are, and you want to go on your merry way, that's also okay.
Mhm.
You know.
So what's probably like one of the cases that's most memorable to you, someone that you really helped that, it made a big change. Can you tell us a story about that?
Yeah, yeah, absolutely. I was just thinking about that. So I have a few different scenarios to give people idea of who I can help. But I had a 53-year-old female more recently who had thyroid issues and cholesterol issues, and she had a lot of GI issues like bloating, gas, hemorrhoids, constipation. So we had her come in, we reviewed her regular lab work from her general practitioner, and saw that she had uh, low thyroid and high cholesterol, and she did not want to take medication. She wanted to pursue alternative treatments.
Hmm.
So we got her on a good supplement and diet change program, which helped her a lot. And then we looked at her GI issues with a stool test, and we identified where she had challenges with her microbiome, some overgrowth, some potential pathogens. So we addressed those issues again with diet and supplements, and 3 months later, she was already seeing changes in everything. 6 months later, her thyroid was normal, her cholesterol is down.
Wow.
So,
Amazing.
her GI symptoms are much improved. So,
And that's a big issue because like you want to be able to eat like, all the time.
yeah.
That can affect you any time of the day, right? So,
And the
yeah.
fact that her thyroid, she didn't have to get on the levothyroxine that everybody is on, the Synthroid. I mean, her thyroid numbers were just normalized.
Yeah.
And she doesn't have to stay on that thyroid supplement. They're still staying normal. So
Awesome. So
that's kind
now
of cool.
after making these changes during those 3 to 6 months, how long does a person generally have to maintain these changes? Like, do they stay on the supplements and do they keep those nutritional guidelines probably forever because you know that that's their sensitivity or not necessarily?
So the nutritional guidelines definitely I think people should try to follow because they're very tailored and customized for
Mhm.
your specific health. Um, Even though I'm not like a dietitian, but still the general rules are good to follow. But the supplements, I encourage people to get off of most of them. It's a 6 month long program.
Mhm.
So I don't expect people to stay on most of them. I will, of course, be happy to prescribe like general supplements that I think are healthy for you.
Hmm. Okay, cool. So I think that explained a lot of it. Was there anything that I didn't ask you that you want to add that adds to the
Hmm.
experience?
I think that the one thing that I would add is that I think people might feel daunted by starting something this big. They might feel, oh my God, I'm overwhelmed, not sure I can do this. And for that kind of person, I would say, listen, first off, give us a call. Let's talk. Let's see where you're at. Let's see if we can help you. And if so, and you want to start with us, again, we're happy to do just what you want to do, just what you can handle. If I think you should do 3 tests based on your health findings, but you're not ready, let's start with one. And
Hmm.
then even with one test, I can give you the whole outline of what changes I think you should make. But if you can't make all of them, let's say I prescribe 4 supplements, but you can only handle taking 2. So we'll start with the primary 2. We'll
Hmm.
start with small steps go a long way, is all I
Yeah.
want to say here.
Yeah.
Don't feel like, oh, I'll have to change my whole life. You
Yes,
know,
that's true. But also, like for somebody, like you said, this particular client that you're speaking of, like she didn't want to go on medication. So that would be someone who'd be perfect for to
sure.
see you, or someone who um, was just not necessarily medication, but like just suffering on a day-to-day basis, but they haven't been able to find any other answers, and like regular traditional medication or medicine hasn't really helped them. That would be
So
someone that would be perfect.
I'm going to say someone who is already health conscious, someone who wants to get to the root cause of their chronic health issues, someone who doesn't like reaching for the medication on a daily basis.
Hmm.
Those are my, perfect clients, perfect patients because they already are very health conscious,
Hmm.
and they are trying to understand how can I fix myself? I don't want to just mask the symptom
Hmm. Okay.
because that's really what we're all about.
Yeah.
Root cause.
Yeah, no, and that's great, especially the whole medication thing, because you just don't want to have all the side effects of cholesterol medication or diabetes medication. Like, and once you're on them, it's very hard to get off. So the longer you can stay off, the better off you are.
Exactly.
Um, that's great. So tell me a little bit of maybe anything about your approach or your services that maybe most people don't know when it comes to getting to the root cause. Like, is there anything that most people might not know or expect?
I think, as I said before, I think that most people might think it's daunting. And I'm here to say that it's really not as daunting as you might think. It's a journey that starts with one step. Like a journey of 1,000 miles begins with one step.
Mm-hmm.
You
So,
know,
do you have any like just general wellness tips that you might give most of your clients that you would, maybe just one tip that you would like to share that can help improve someone's health or wellness?
Absolutely. I'm going to say, without fail, my number one thing would be to get your sleep under control. To,
That's
you
so
know,
true. Yes, I agree with you.
Get
Yeah.
your sleep under control and easy things. Morning light sets your circadian rhythm. 15 minutes of morning light. You don't have to be outside. You could be near a sunny window. Take
Mhm.
your glasses off. Don't wear sunglasses. Don't wear the sunscreen. Just 15 minutes of morning light will set the circadian rhythm. Secondly, and we've all heard this, like 2 hours before bed, no screens. No, especially like the iPhone, the phones,
Phone. Yeah.
right? No phones. And eating 3 hours before bed is probably best not to eat 3 hours before bed. So little sleep hygiene, make sure that the room is pitch black.
Yeah.
So
Okay.
just those few things to set because if you can't sleep, you can't heal.
Yeah. No, I agree. That's when all the healing and recovery happens. Yeah, I completely agree with you. That's true. So, somebody who's having trouble sleeping, and they've done all of these sleep hygiene things. I actually had a
Mhm.
patient who was going through this, and she had even done um, cognitive behavioral therapy, CBT, to help with her sleep, but she would keep going into relapse. Like she'd be good for a few months and then go into relapse. And, she knew all of the sleep hygiene things to do. How could you help someone with
It's
that?
another That is another great question. So another case that I have is a 50-year-old male who is generally very healthy, eats well, does all the right things, exercises. He came into me not long ago, probably 2 months ago, and was telling me, I'm consistently waking up at between 2 and 3 a.m. I can fall asleep, but then I'm up again. So what can we do? So we brought him in, we did his health history and all that, and we decided to do saliva and urine testing to identify what's going on with his hormones and his cortisol levels.
Mm-hmm.
Well, sure enough, things showed up where he's what we call wired and tired. His cortisol levels were spiking more while he was asleep,
Mm-hmm.
where they should be really plateaued, flatline almost, right? So we changed a few things with his diet and his lifestyle and gave him adrenal support because when you're wired and tired, your adrenals are burnt out. We gave him adrenal support. We gave him just some sleep support with benign supplements and the targeted therapy. Really, in 1 month, he's sleeping.
That's awesome.
Right. In 1 month, he's sleeping like a baby. We ask him all the time when we see him, like, how are you doing? He's like, I'm really doing well,
That's
which is great.
awesome. And then he's probably also, following all the sleep hygiene tips that you've given him, in addition to help
Yes.
support all of that. That's
Yes.
amazing. And
And
I'm
little
sure,
tweaks just made his adrenals so sometimes you're just, you're a healthy person, but you just need just that little something,
yeah,
you know?
yeah. No, that's awesome. Very cool. So I noticed that you've done like on social media. I follow you. By the way, if anybody wants to follow you on social media, they can follow it's I think I have it here at Chatham Chiropractic Center on Instagram, and you're also on Facebook, Chatham Chiropractic, right?
Yes,
So
correct.
definitely follow Dr. Sonal. But I know you've done stuff with other businesses in the community. What kind of things do you do with other businesses in the community?
Well, so we did a little collaboration with the yoga studio downtown, Foundations Yoga, where we came in and we did how the gut is affects your anxiety and also how yoga then can help with anxiety. So we did the whole gut and brain connection, and she did the how yoga can help calm you down. So that was a really nice collaboration. So it was a lot of fun with people, listening to my lecture for half of the session and then also doing some yoga at the end and meditation.
Nice.
So that was lovely.
Very cool. So that's a really good way to connect to the community and help people to know what you do and how it could help them. Yeah.
Yes.
Awesome. Do you guys ever run any promotions on your functional medicine packages or anything like that? And what does that look like? Is there, how can people find out about those?
Sure, absolutely. We run them all the time, and we like to start in the spring because everybody wants to do a spring cleanup and clean up your health too. So we're running $100 off the first consultation and for the entire spring, starting, I guess, March 21st is the first day of spring.
Oh, that's
So
coming up, coming
yeah.
up. Cool. So it's $100 off the initial
Mhm.
consultation. Very cool. So that's good. Um, And then it's a package, so that lasts for 6 months. So if someone starts now, they'll probably be done in the fall, just in time for
Correct.
starting. So that's perfect timing. Okay, cool. Thank you.
Mhm.
So tell us a little bit about your office dog.
Oh, my little doggie. She's up here. Uh,
She's like one
so
of the most beautiful dogs I have ever seen.
she is such a sweetheart. She is a Irish setter. She's about 7 years old now, and she loves to be in the office and get up and greet people and loves treats, of course, and pets. So she'll just lay down and, with her belly up and have you rub her all day long until you
Oh,
go in the room. She
so
doesn't like closed doors though, so she won't go in the room all the way.
okay. So that's I love seeing your dog whenever I see she's beautiful. So
Thank you.
for anyone who wants to start working with you, what is the next best step for them? How do they get in touch? Do they call? Do they email?
The best way to get in touch is really by phone because we are very good at answering and returning phone calls. So they can just call our office at any time. And even when we're not here, I check messages even when we're not here.
Okay,
So we will
awesome.
return your call in 24 hours.
Okay, cool. And then you also have a website, I know, chathamchiropractic.com, correct?
Correct.
So they can
Hmm.
also go on your website and read a little bit more about you and the practice and how it can help them.
Sure.
Um, and then again, the Instagram handle was at Chatham Chiropractic Center for anyone
Yes.
who wants to follow you. Perfect. Thank you so much. It's been great learning all of this stuff.
Thank
Is there
you.
anything that I didn't ask you that you want to share?
Hmm. Come on in. It's a fun place to be.
It definitely
Everybody
is.
leaves smiling.
Yes, I can vouch for that. Great. It
So,
was great having you on, and thank you so much.
thank you, Tejal. Take care.